With respect to the future, I think there's the big question is how to optimize maintenance therapeutic strategies for older patients. We ourselves actually have a trial that we've completely accrued to where we're looking at ibrutinib maintenance therapy for up to 4 years. And this includes patients who are older. It includes patients across all age groups, but we may get some insight there about whether ibrutinib monotherapy as maintenance would be helpful in this particular population. There are actually trials that are ongoing that are specifically addressing therapeutic strategies in the older population. One of them is the SHINE study that's actually looking at patients over the age of 65. They're treating them with bendamustine Rituxan as a backbone, with or without ibrutinib, and then they're also sort of addressing whether ibrutinib with Rituxan versus ibrutinib with Rituxan versus Rituxan monotherapy as a maintenance strategy may be useful. There's actually another trial that's being conducted by the Europeans, the MCL, our squared elderly trial, which will also look at whether Revlimid is an appropriate strategy for the maintenance setting. So really a ton of trials that are ongoing that will address optimization of maintenance in older patients.